Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Knee to Know Show, I'm going to share with you 3 advanced exercises you can do to work on your knee flexion or bending range of motion. So the first one, all you need is some sort of step or something similar that you can step up to. So if you have stairs, that works awesome, or something similar works well too. So all you're going to do is take the leg that you want to work on the bending and the flexion with, and you're going to put that leg up on the step in front of you. Now all you're going to do is use your body weight to provide some overpressure, to provide some stretch into knee flexion. So basically you're doing a lunging type motion, but you're really trying to focus on bringing your body weight forward, shifting forward, letting that ankle bend, and trying to bend the knee at the same time. So you see, as we do this, you're starting to get that increased bending or flexion. Now it might not be very significant, it may not be up to your limit at this point, but you're starting to get that motion. Now you can do repetitions back and forth like this, or you can go right into the end range and hold that position for a prolonged time, maybe 10 seconds, 20 seconds, depending on what you can tolerate. Now when you get pretty comfortable at the level or the step that you're on, then the progression is to go up to the next step up on the staircase or whatever you're using. So for this example, I'm using the chair as the next step up. Probably in reality would be probably 2 or 3 steps higher if you were on like a staircase, for example. And then you're just going to bring your foot up to that next level. And now you'll notice as you lean into it, now you're really starting to increase that flexion, increase that bending range of motion. Same exact principles, really leaning your body weight forward, pushing into that end range. You can do repetitions again, you can hold it, but just notice how much more flexion and bending of the knee I'm getting now. If you're tolerable in this position, you can go up a step again until you kind of get to your limit. If you feel this is too intense, this is too much, then come down a level, come down a step, and go from there. So it's really easy to adjust to where you are in your rehab and your range of motion with your knee. But again, simple thing, just using your body weight, doing this forward lunge onto the step, and then increasing by going up the steps or down the steps as needed. So that's the first exercise. The next exercise, you're going to use a chair or anything that you can come and put your leg up on. So you could use a stool, you could use a bench, anything like that. Now I'm going to put a pillowcase here just because it's a little more comfortable, and you'll see why. So what we're going to do is you're actually going to bend your leg so your knee, essentially you're kneeling on this chair. So now you know why, if you have a little bit of discomfort with kneeling, having something very soft and cushiony there is going to be helpful. And now you're going to use that same exact principle of using your body weight to increase that bend, increase that flexion. So basically what you're going to try to do is sit down into your heels as far as you can and then come back up. Again, same idea, you can do repetitions, or you can get down until your limit, till you're as far as you can go, holding it for maybe 10 seconds, 30 seconds, and then coming back up. So I'll show you from the side as well. I'm going to have the leg a little forward so you can see it better. But again, you're starting in this position, so ideally you want to at least be at 90 degrees of flexion, because you have to have a certain amount of knee flexion just to get up on the chair like this. So really you want to at least have about 90 degrees or more before you start trying this exercise. And so again, you're just going to sit down, and you can see as you bend down, you can really bend and flex that knee pretty far. Again, go within what you're comfortable with, what you can tolerate. You don't have to cause significant pain and discomfort. You might feel it a little bit, but you don't have to aggravate things super intensely. You don't have to go super intense, but just enough where you get to your limit and kind of push that limit a little bit at the end. That's number 2. The last exercise for this video is you're just going to use a chair. So this might be one that is maybe one that's easier to start out with because it requires a little bit less motion. But again, you're going to use your body weight to help improve your flexion. So I like to start sitting back in the chair and bring my feet back pretty far, almost a little beyond 90 degrees of bend. And then what you're going to do is you're just going to shift your body weight forward. So shift your body weight forward, keep your feet planted, get to where you feel comfortable, hold that for a little bit. Okay, you feel pretty comfortable. Go ahead, shift your weight a little more forward. You'll see the bend starts to increase. Don't move your feet, keep your feet planted. Again, shift forward if you feel comfortable. Hold this for maybe a couple minutes, see if you tolerate it okay. Maybe this is where you stop for today and you don't go any further until next time. But if you feel comfortable, maybe try shifting up a little bit further. And at some point, you're going to be all the way on this edge and you can really just start to kind of lean, do this hip hinge, leaning into that bending or flexion. So this is probably a good initial exercise of the three because you don't go into as extreme amounts of flexion. But if you're someone who is in that 90 to 100, 110 range and you're trying to increase your comfort and ability to get to that amount, this can be a really helpful exercise as well. And then just a bonus one here is, again, we can bring in the stretching strap or your rolled up pillowcase or towel or bed sheet or dog leash or belt or whatever you have, and you can do a prolonged stretch in this chair as well. So I like to put the loop around the ball of your foot, and then you're just going to take the rest of the strap and put it underneath you, so right down the middle underneath, and then it's going to wrap around the back leg and come up like this. And then you're just going to slide backwards, let it slide. When you get to that sticking point, provide an extra pull. So you're going to pull it, kind of get to that point where you're sticking your end range. And you want to hold this as long as you can tolerate. So we talk about low load, long duration. So hold this stretch, this moderate intensity, bending, pull, and see if you can hold it for a few minutes, 2-3 minutes, even longer is great. And then slowly let it relax back off. What I tell people is think about if you're watching a commercial, during the commercial breaks, you go into this position, hold it for the commercial break, maybe 2-3 minutes, whatever it is, and then when it's done, you can let it relax back down. So there you go, everyone. That's 3 advanced type exercises, really actually probably 4, is the chair one is probably 2 different ones, for increasing your knee bend or flexion, either before or after knee replacement surgery. Be sure to leave a like if you found this useful, and please leave your comments and questions below. And as always, please be sure to subscribe if you enjoyed this video and want to catch other videos related to knee replacement surgery, exercises, stretches, range of motion activities, frequently asked questions, discussions, and everything else in between. Thank you very much for watching.